Hi, good morning, everyone. I'm Lori Lowell, the Executive Director of Home Haven, and I am excited to present this program. Um, we're going to jump right in. We're just going to jump right in. I'm going to introduce a Home Haven member, a very active member, who will then introduce our speaker. So Judith Colton is a member of the board. She also is a co-leader of the Hamden North Haven Village. And she is co-chair of the Visitors Committee and serves also on membership. So that said, Judith, you know Sharon personally, and it was your excitement and enthusiasm that led to this program. So first, thank you so much for sharing with us what you've been learning. And I turn it over to you.
Great, thank you very much. I'm going to start by saying that meeting Sharon Hallahan and going into therapy with her has actually changed my life, has made me a far more upbeat person with regard to my problems, which are severe and which don't look much better yet, but I know they're getting better and that they will. But this only started in late May. So there's much more to go on that. But turning from me to Sharon, which we need to do, I'll just say a couple of things, and Sharon will both correct me, I'm sure, and carry on from there. Sharon graduated from Colorado State University, majoring in foreign languages and art, and minoring in neurobiology. She then went on to do a degree in PT at UConn, and since then has worked basically all over the world, worked and volunteered from St. Rafe's here to St. Jude's on St. Lucia in the West Indies, to Vail, Colorado, where she worked alongside a renowned knee specialist and treated, what do they call the Denver Broncos and the U.S. Olympic something or other team. I forgot which team, but anyway, I knew I need correction. I'm going to let her tell you much more about what she's decided to do in physical therapy and what it's about. Sharon, please carry on. And thank you for being my wonderful physical therapist.
I'm going to interrupt to give the name of the program, A New Approach to Back Pain. So let me just toss that in. I apologize. I didn't say it earlier. Thank you.
I should have said it too.
Thank you, Judith, for that lovely introduction. And thank you all for coming. I'm passionate about this new approach, and until I can share it and spread the word, it's really unfortunately
Come
not.
in.
Bad news, they're on order.
Everybody, please mute yourselves.
So it'll be
Please mute
tomorrow,
yourselves.
next week, I don't know exactly.
Which
Kate,
means we won't be
go
able
ahead
to
and mute
go on
everybody.
then, right?
Well,
Sharon, we're very sorry for this interruption. We will get it worked out in a minute. Okay, go ahead, Sharon.
Okay. So yes, I'm Sharon Hallahan. I've been doing physical therapy for about 32 years, and it wasn't until about 10 years ago that my focus really began in spine. Right now, the avenue that I've been taking is focusing on scoliosis and what we call malalignments. Basically, our spine is supposed to be in one direction, and as we get older, we tend to fall forward or sideways or whatever direction we pass our time or our bias because of an injury. We end up leaning one way or the other, and our body accommodates. And the unfortunate result is back pain because of this chronic asymmetrical positioning. So it's been very interesting how in traditional physical therapy, we haven't found really much that's long lasting, that is able to carry over, or that is something that's given to a person. For the most part, if you have an ailment, you should come to PT twice a week for the next 6 weeks, and we'll see if we can fix it, versus this newer approach, which is really not for everybody. It's for those that are interested to take it on themselves and say, okay, I am in control of this 24/7. I am going to look at these ideas and apply them myself. And then it's something that over time starts to change the asymmetries in your spine to where some of the strained tissues get a break. And that's an incentive when it becomes a reduction in pain. And therefore, people tend to want to attain these positions and this activity more often. So I moved away from being in the outpatient clinic that I had been in for years in Essex and opened my own private practice and get to be working one-on-one with people, which is such a great opportunity. I don't need to finish at a certain time. I don't need to report everything and have it be so that I'm on my computer the whole time. I can actually look at people and look at what's really happening, look at the whole person and make suggestions. So it's been a really neat opportunity. So the basic concept to helping one's back is to understand what the spine is doing. So our spine is very unique in that we can go forward and back and side to side and we rotate. But over time, these three movements that actually work together, they couple together over time because of either the bias of our eyes in front of us or our phone or the steering wheel or whatever the case may be. As we get older, some of our structures, our ligamentous structures, muscular structures become weaker and a little bit less stable. And so we tend to fall forward or laterally into the direction that our bias is in. And it's harder to get it back as we get older. So we tend to just fall a little bit more. And so we all know and seen people who are really falling either forward or sideways. And you can try to come back. You could come see me at the clinic and I could give you some stretches to do, but it's really, I think it's more about learning why it's happening and how we actually control that. Understanding that as soon as we come forward with gravity, our spine, our vertebrae start to side bend and rotate. And that makes now these tissues, instead of just going straight forward, now they're going around a corner and they're going sideways. So they get longer and they get weaker. And it makes it even that much more difficult to expect to pull back against gravity. So the real ticket is to try to understand where your spine is and where it should be so that you can get yourself in your best postural alignment as often as you can so that all the soft tissue structures, the muscle firing, all the information that everything's working all day stops happening in this direction and starts happening a little bit more with a central postural alignment. A good example is if you have, people have heard of sciatica, for example, if you have two vertebrae that should be equidistant, but are kind of side bent, or if this person is facing forward this way, they're bending forward. So the vertebrae are coming together in the front as they bend forward. And in the back, it's open. So the disc material, kind of like the jelly in the center of the donut, should be on center, but with enough forward compressive forces, that disc structure or the jelly in the donut has nowhere to go but backwards. It's actually being pushed backwards from compression, and the spinal nerves all exit at each level of our spine. We have nerves that leave the spinal cord and give information to that body at that level. So out of my neck, it might be in charge of my arm, out of my trunk, maybe my organs here, out of my lumbar spine or low back where the nerve exits from the spinal cord, that will go down my leg. So whatever level the disc material's getting pushed out at is where it can contact that particular spinal nerve and then irritate that nerve along its distribution down your leg and into your foot. So the idea really is to say, hey, if I'm pushing everything back on that nerve. How can I take the pressure off? And that is to open up that front side, restore the normal distance between your vertebrae. And while you're opening up this front side, the disc material has now somewhere to go, somewhere to settle back, and it will. It is the structures of our body have been that way for years, and they want to go back to where their normal length is. So people with sciatica that they've had it for 3 years, it's still, the disc wants to recede back to where everything is kind of home. It just doesn't have the opportunity if what used to be a posture like this is now a posture like this. And so there's nowhere for anything to come back to the center. It's all pushed back there where my nerves are exiting. And then I have all the resulting pain. So by aligning those 3 planes of motion, we start with getting our trunk back over our pelvis as best as possible. And when that happens, we end up coming out of a side bend as well. We end up coming out of a twist because, like, taking 2 ends of a line and pulling it, you're going to kind of come back to the area of least resistance and to the straightest line. So we're trying to get ourselves back so that our vertebrae are like building blocks on top of one another. And when that happens, it's when I'm gardening and watering the plants, I stop and I kink the hose to stop the flow. I go to the next garden, I open the hose. We get a full flow when we return everything back to center. Excellent circulation, excellent decompression of all the soft tissue structures that are getting cut off from circulation because the constant compression stops oxygenated blood getting there like a bed sore. It's the same. You're just constantly in one posture, and the bias is squishing those healthy tissues and making them a little less participating. The same thing happens at this section of our spine where we have lungs. Our lungs are also going to become compressed at that area where the vertebrae now are turning and closing down. We don't have the opportunity to uptake the air in those lobes of our lungs. So we see a change in our pulmonary mechanisms. The nerves that are getting squished become injured, where you start to feel tingling and numbness, which then leads to pain, which then leads to actual muscle. The motor component of the nerve makes the muscle become weak, which people who have sciatica, first they have numbness, tingling, then they have pain, then they become like drop foot. Their foot is not functioning because the motor piece, the part that tells our muscle to stay alive, is being compressed. So the nerves being compressed cause a very serious problem in functioning and ambulation and gait and using our arms. And then mainly it's just the compromising of the soft tissues and the organs, because what we're housing around our spine are vital organs. So we're coming to be able to come out of a position where we're slumping and to not only open up, but to try and raise up. We are decompressing and offering an opening so that we have the nutrients coming through, the waste products get to push out, the nutrients can come through, and we end up with a much better metabolism for all of these structures that have really seen better days because they've just been like strangulated. It's the same as a tourniquet. You have no opportunity to nourish these structures. So that's usually the pathomechanism, the reason that these structures are so compromised. Of course, there's a myriad of other diagnoses that contribute, but for the most part, we find that when you come out of your postural alignment for long periods of time, those things happen. We have pulmonary inconsistencies, we have denervation of the nerves, we have compression of the soft tissues. So how can we try and reduce that is basically to return to our best postural alignment, which is what we call our sagittal alignment, which is the sideways plane. So if you can remember someone in the military, their ear is over their shoulder and their shoulder is on top of their hip. If I'm forward with my shoulders, I can't get my head back where it should be because this portion of my spine is bent forward. So I need to bring my shoulders back and then I can bring my head back. When that happens, I can actually get a restoration of my lumbar spine. This sideways or backwards curve can occur when I'm sitting up tall. But as soon as I go forward with my head, you can see I lose my lumbar spine. And if I don't fix my lumbar spine, I can't bring my head back. That's as far as I can get back because our spine is like the snake toy. If you take up the slack in one area, you're done, you've taken it all up. So you have to make sure that your pelvis is forward, that you have this lumbar support for you then to be able to have the opportunity to retract your shoulder and bring that over your head over your shoulder to then have your shoulder over your hip. The problem is that gets tiring. It all seems well and fine, but after a while, you're gonna just fall into a slump. And so that's why people use lumbar rolls, or it doesn't matter what you use. You can put your water bottle back there, but when you push your butt to the back of the chair, you put something here and then you go to relax, something's kind of stopping you, and I'm able to maintain that lumbar lordosis here. When that happens, then you're in control of what happens up here. You can be on your computer, but after a while, you can also come back if you have your pelvis in the right position. So really, it's the pelvis that dictates if you can return to that best postural alignment with one vertebrae stacked back on top of the other. And our culprit is relaxing. Horrible. But when we relax and sit down on the couch and we fall back and our butt sinks in, then of course our head comes jutting out and we're in the letter C. We're in that kind of rounded back, which began it all, which takes our vertebrae and puts us into that asymmetric positioning. And then over time, the load is just asymmetrically and that's when we start having the increase in pain. So that return to the sagittal plane or to the correct alignment with your ear over your shoulder and your shoulder over your hip. But I know it's easier said than done, but what I usually ask people to do is to break it up in opportunities to sit in a dining room chair, say at certain times when you're relaxing in the evening, or to take a bunch of pillows and put them on your lap and then put your iPad on or arms on top of the pillow so that, oopsie, what happened there? Oh, you're muted.
That's something that, it's something that Zoom will do. If you put your hands in that position, it gives you fireworks.
Oh, that's so exciting.
Yeah.
And then also, if you're sitting on a couch and your bum is sinking low into the couch, we know that as soon as your bum gets low, you'll go into that letter C. So a lot of people actually purchase a wedge where the back of the couch or the back of the seat is a little high and it comes forward into a small piece of pie in the front, which then instead of falling again deep into a couch when the weight's over my butt. So as my weight goes into the couch, it falls in and it lets me go in the C. But if there's some more height or structure under here, then I can maintain my lumbar lordosis by having the support under my bum. Some people will just take a pillow, a decorative pillow, a sleeping pillow, and put it under their bum to the back of the chair or a couch pillow from the couch, but anything that can give you that support under your pelvis will discourage the pelvis from falling, which then will bring you into your letter C, which then puts your head forward and gives you your poor alignment. So I think before the fireworks started, I was talking about sitting in the dining room chair. Because that firmness underneath our pelvis enables us to have control over choosing when we return our postural alignment back to the best we can have it. So then you can have your dining room chair for a little bit and then go to your couch. But you need to, if we can break it up, it's like taking that tourniquet off or that rubber band off your hand for about 5 minutes. We'll sit there and offer that good circulation and then go back to our comfortable positioning that might not be in the best alignment. But if you can imagine offering an intermittent spit of oxygenated blood around all those regions, you're not going to see the same wear. You're going to see better tolerance. It's not going to get into the level of spasm as quick. Usually you start to earn a little bit more to where your symptoms aren't coming on as soon just by attaining that position intermittently. Another piece to returning to your best alignment is something that we call elongation, which is not any big grandiose news, except for it's the idea of the rope coming out of your head, pulling you up as tall as you can be. But what it does when I do that is it helps automatically return me to that good sagittal plane alignment that we know we need to unload all of those compressive forces. So if I'm relaxing and I say, oh, I'm going to do 3 elongations right now, it would look like this. Someone's pulling up the back of my head, up out of my head is coming out of my shoulder girdle, like a turtle head coming out of a shell, making this length get taller. At that moment, I have reduced all of my poor posture and I'm back in my lumbar curve. I'm back in my correct upper curve because I'm, again, finding the straight line between 2 ends and pulling on it. And so here I am automatically returned, but at the same time, I'm also decompressing those compressive forces that are causing my pain. So if I say I'm going to elongate, get as tall as I can and hold that for 5 seconds for 3, 2, 1, and then I go to relax. It starts to tell my brain about that range of motion, like the range of motion I have in my elbow from bent to straight. What's my range of motion of what I can get out of my spine? It's from here up to here. And then I hold for 5 seconds and then I collapse. The difference between those 2 points is when I start to learn about my spatial awareness on how correct can I be and what it feels like to collapse. And it's interesting, the more people practice the elongation and hold for the 5 seconds and maybe just doing 3, sooner than later, they start to notice when they're in the mid-range or when they're at their end range. And it's easier to pull up and come to your full range when you have that comparison from beginning to end. So I like people to go through the range of motion so that you can learn how high, what's your length of your spine? How high can you use all of these extensor muscles and these paraspinal muscles to work up against gravity? At this point, it might look like you're going a half an inch, but in 2 weeks or 2 months, you might notice in the mirror how much higher you're getting. That's strength and that's range of motion, stretching some of the smaller muscles that get squished and don't really get a chance to get tall. So elongation decompresses the compressed regions, but it also opens your lobes of your lungs where you have compression. So if I'm in here and I have a side bend, or even without scoliosis, I just have poor posture, I'm getting compressed as I open up and inhale and elongate. I'm maximizing the uptake of the oxygen in those regions. And we see that on ultrasound. We can see that happening while we're doing studies on people with elongation and opening their breath, so to speak, by trying to think of opening your rib cage. So that brings me to my next topic, which is called expansion breathing. This is in combination with elongation, because without making space, I can't open the lobes of my lungs any more than I already have been offering, which might have been compromised. But when I'm offering this elongation and this opening, I can breathe in, and we can see that we have an increase in the width of someone's rib cage. So we do the study, we know how much opening you're getting when you're taking a big deep breath in, and we measured that, and we can see when you exhale how you collapse, and as you inhale, we almost automatically elongate and get taller. And as that rib cage expands, we have space to bring more air in. All of the muscles of respiration are no different than the muscles of your leg or of your neck. We want to offer them their chance to get strong again, but they can't participate when they're compressed. So the combination of all of these concepts together is what really, I think, hope will be the take home today. Coming back to your best alignment, elongating as tall as you can, offering that opening, and then when you can, doing this expansion breath. The expansion breath is a concept that it's actually a scoliosis concept, but it can be applied to an asymmetry in any direction. So you think of scoliosis as someone side bent. Well, it's also someone bent forward. See someone at church who's all bent forward. It's all a asymmetric alignment or a malalignment. Either way, the structures are getting squished on one side and the other side is wide open. So we need to reverse that scenario. And so the expansion breath had begun with the scoliosis in mind. But basically, if you can open up your rib cage with your diaphragm, because your diaphragm's like an umbrella. When you breathe in, it opens like an umbrella under your rib cage and holds your rib cage open during that time that you've inhaled. During that moment, you've used your rib cage to create that space that you've just established with your elongation. And now you're asking those muscles to get stronger there. And the way that they do that is with this expansion breathing is what, after you've breathed in, you used your diaphragm to push your ribs out. Then we try and hold that there with our muscles by doing a slow pursed lip exhalation. And it's like, it looks kind of like this. And we see the ribs slowly coming back. That's the strengthening that's happening. In between all of our ribs, we have intercostal muscles. The ribs attached to our sternum in the front, and then they wrap around the back and attach to each vertebrae. This whole vessel is to protect your organs and your spinal cord, but there's nothing on the outside. There's none of our long levers or doing sit-ups, or nothing will change this cavity except for air. When you inhale air is when you get to distract and open all of these tissues. And as the ribcage adjusts to your being folded, so to speak, in a poor posture of one manner or another, you affect that and change that with the air by opening the ribcage and stretching all of those muscles with this volume of air. Then we're holding it, trying to get these muscles to wake up and get strong here in this open position. So we're not letting them just go. We're going in, and then the slow exhalation tends to let these muscles have a lot more work. An example is taking a bicep weight and pulling it up. And that's hard, but lowering it down is much, much harder. When you get that muscle long, is a lot more challenging to the force of a muscle. So it's like that with breathing. When you breathe in, the diaphragm opens concentrically. It's the harder work to slowly exhale, but that's where the strengthening is. So the combination of restoring your best postural alignment, then adding in the elongation, pulling your head up out of the turtle shell, which will then just even assist all the more to get your curves as straight as possible, creates the space to then open your ribs with the inhalation and hold that opening as you exhale. And that's the training that starts to reinforce this position instead of this position of the slumping. And we find over time that people absolutely have a pain reduction in all of the strained tissues on the other side that are reaching to hold on to those vertebrae. They're just falling forward with gravity because we're just in a relaxed state. But it's not so, it doesn't end up being very relaxing because it causes pain. But if you want a trial, I would suggest if you put your hands on your ribs, and if you can, I'm gonna show you my side view first. So you might be here in a relaxing position. I would ask you to roll kind of forward onto your butt bones so that your muscles don't have to go around the corner of this C or this slump, and you'll be much more successful if you don't have to go around the corner. So you're up as tall as you can just on your butt bones. And then if you can trial bringing, it's not your head or your eyes, your eye gaze stays level. It's this portion of your spine right back here. This is where my spinal cord is. My spinal cord isn't up here, it's back here. So as I'm trying to elongate, I'm trying to elongate all the muscles around my spinal cord. So you'd see an elevation up at that portion of your, oopsie. You'd see an elevation of the back of your head versus the front of your head like a chin. So then once you're elongated as much as you can elongate, then is when you would take your hands on your ribs and then see how it feels when you breathe in, how much pressure can come out on your ribs. There's chest breathing, which I'll show you first, which brings all the lungs up to the area where we probably don't have the same problem if you're having low back pain. If you have neck pain, then that's an issue. But either way, we want to discourage your shoulders from rising and breathing with pressure out into your ribs like this. It's as if you're trying to get your tummy wide, really expanding. And then as you exhale, see if you can keep the tension and the pressure as you exhale slowly, but then you do need to lose all of your air, essentially, so that you're not holding your breath. But the ideal is to come into these positions, intake the air, hold that, slowly exhale your air, but don't collapse. Keep your upright posture, keep the tension, and then when you're out of air, increase again. Doing that 3 times is when you're doing this exercise. At the end of your 3rd time, you can collapse and relax, but the constant hold of that opening is where you get the strengthening. It's quite different than doing a sit-up or trying to look at the muscles on the outside of all of this basic cavity. It's taking the muscles that are really dictating where our vertebrae are, dictating the behavior of the problem of our spine. Those muscles are connected to the vertebrae, and those are the muscles we get to address when we use our ribs, when we use our air of our lungs, because of the fact that they are in this perfect little circle. There's nothing else that really touches the circle as deeply or effectively. So trialing this expansion breathing is a really helpful way to unload some of the forces that cause pain in our back. So when I'm sitting here against gravity, I'm sure, as you know, it's a lot higher forces than if I were lying flat. And that's one of the things we find when people have a lot of pain in their spine is if you can get off your feet. I oftentimes tell people to lie down 5 times a day, and people are busy, things to do. I'm not going to lie down in the middle of the day, but if you can get away from being vertical and get horizontal, you lose 10 degrees of force of taking you out of your neutral rate, regular straight vertebrae alignment. So if you can lie on your back and then get into these positions, which I'm going to show you, and then do your breathing, you have a far better chance of truly affecting all of the lobes of your lungs, really opening your thorax and getting a better uptake of oxygenated blood while you're in supine than when we're sitting and gravity's kind of forcing us to go into these postures that we wish we had more control over. So a lot of times I request that you do this practice supine. It makes it a little more realistic because fighting up against gravity takes a lot of muscles and takes a lot of endurance, and you can't just go from A to Z. So getting off of your bum, off of your feet, lying supine does a few things. It helps you restore that back and front automatically because you're on your back. If you have to have a pillow, that's okay, but we want to have the least amount of pillow because I don't want you to be pushed forward. Our ideal is coming back. So we lie on our back. We get the correction of the front and back just from being on our back. Sometimes people's beds or couch is too soft, and you do need to put a little pillow behind your back at that lumbar support so you don't fall in, because you don't want to be in a bad posture. You want to be as close to your alignment as you can. So taking a little couch pillow and putting it under your lumbar spine is sometimes what people need to do. But getting out of gravity, being able to attain this elongation, which I'm going to show you, and then uptaking the volume in your lungs and holding that open during your pursed lip breathing so that you're slowly expelling your air. That's where the real work is. So I'm going to see if I can show you this move, and I'm not sure. I think that might work. I'll see. Yeah, so basically, if I can make sure I don't have a pillow, I don't have a pillow under my head, pushing my head forward, then my head will be back. And if my head is back, then I know my ear is probably over my shoulder and I'm in a good alignment. If I have a soft couch, I might be rolling back and I can't get my hand under there. So that means I don't have my lumbar lordosis. So I get some kind of a soft support under here so that now I do have something pushing me into a good postural alignment. I feel like bending your knees, people's knees, gives a little less strain to a low back. So if you have a low back issue, you might find that bending your knees is more comfortable. If it doesn't matter, I don't mind you pushing your feet away because we're trying to get you long. And then I also would like to try and have your arms come up and away so that I'm getting this length through my trunk, really trying to elongate here and elongate down by pushing my legs away, pushing my trunk up. And so when you're on your bed, it's really about your thoughts. Your thoughts have to be, how do I get long? So you want to push your feet away, getting your pelvis further away, bring your arms up, maybe even wiggle a little bit or trying to inchworm up to get your trunk out of your pelvis. Then your head is also trying to come up again, just like that elongation we did. If you can hold your arms above your head without any shoulder pain, then it keeps the pull of everything upward and open. If you can't, I just have you try and rest your elbows wherever you can, and the higher you come, the more pull. And then worst case scenario, if your shoulders are bothersome, you can just keep your hands where you are. But now the idea is you're in a better alignment front to back. You can elongate as much as you could possibly think of getting yourself long. And that's when we try and do the expansion breathing. No shoulder hiking, it's just all out. Trying to open and enlarge and hold that width as you slowly exhale, not allowing any collapsing. Full breaths for 3 times as tight as you can. Last time, hold it, and you can see the difference when I collapse. So that's using a group of muscles that truly rarely get the opportunity to be exposed in such great alignment that allows the inhibited muscles or the weaker muscles on the inside that are typically just squished. Now they're actually open, they can fire, they can be recruited. I can tell my brain, turn them on. We can turn them on and we can repeat and repeat, which is what makes muscles grow and or return if they've been inhibited from being compressed. So that is the supine positioning. And I could show another exercise unless it's just becoming overwhelming.
I think you can continue.
Okay, good. I am gonna just recap, because I did have an outline I wanted to show first, because you're supposed to say what you're gonna say it, and then say what you said, and I didn't show you ahead of time.
You
So,
in France.
so the main thing that I'm trying to share is that if we want to reduce strain on our back, we need to reduce the corners around which all of these muscles have to go outside of their normal length. And then when you bring them back to their normal length, they're going to be less strained. So that happens when you come back with your head over your shoulders and your shoulders over your hips. That is your military posture. You can't do that with your neck unless your pelvis is in a good alignment. So you have to look at where you're sitting. If you're sitting on an airplane, you're going to be in a slump because there's no support. So you have to think ahead and bring something for your lumbar spine. It always comes back to getting your building blocks back on top of one another. And when that happens, you have the best chance to gain height, to gain an opening and a lengthening. And after that is when you can open your thorax or your rib cage, this vessel that is dictating where your posture is, by getting wider with air and training those muscles. So getting on the ground, on your bed, on a yoga mat helps tremendously to eliminate the gravity that's already pushing us out of our alignment. So we get all that freedom of that little extra flexibility to even be more effective when we're doing supine or lying down exercises. There's another one that people really enjoy. It's a little bit more demanding in the sense that it can be hard on your shoulders. I'm going to show you this, what we call the semi-hang, with a few different modifications. At home, you don't have this bar that I have, which is what I use for my exercises. But before I got it, I would only use my railings of my stairs, my balusters. So I just hold on to the balusters and do my exercises there, make sure they're pretty steady. Some people will use their, just the ending of the stair, because that's pretty sturdy and you're pulling on it, so you really need it to be sturdy. Or some big piece of furniture. But in general, the idea here is to have something that you can hold on to that's about shoulder height. I'm kind of far away, I'm sorry, I don't know if that will be okay. If you find something that's shoulder height, the hope is that you can bring your body closer to it so that you're continuing to be aware of this good posture. Because then I'm gonna use this one instead, like that. Because then when you get close to it, the idea then is just kind of sit away from it and let yourself hang away from it, and that is going to be essentially dropping your pelvis or your bum and elongating your spine. And a lot of people have amazing pain reduction with this because it's like going to PT and getting on the traction table where you're separating all your vertebrae with force, but this is gravitational force versus at the PT clinic, we put a belt on you, we put the motor on for 110 pounds and you get on the rack, you get stretched. But this is an opportunity to find a way to do it with, maybe if I do it closer here, it'll be easier. With less force. So you're gonna find something, maybe it's a stairwell thing or a baluster. And that one doesn't seem as steady. Let's see, this one seems good here. I'm gonna get really close to it, because if I'm not close to it, if I'm back here, I'm gonna have to round my back to get the exercise stretched. I need to be right up close to it, as close as I can. And then when I bend my knees, and it's basically you have to stick your butt out. And what you should see, I'll show you here. You should see an alignment happening with my back that should be in line with this pole. I should have my butt touching and my head touching, and that is a good alignment. If my head is falling, if I'm like down here, then that's not gonna be good. I need to have my head up. If I'm hunched, that won't be good. So I have to have my butt sticking out, which is really what's making my lumbar lordosis, this backwards curve. And when you align those three planes like we spoke of, your chin is back over your shoulders. I have this curve. I'm in my best alignment is when I can actually see a traction or an opening between each level of my vertebrae. So when I'm here hanging, I usually just do big, deep breaths in and out, no expansion or holding breaths. And as I exhale, I see this opening happening. The opening again is what we're hoping for all around, because we want that separation of the asymmetric loading. So as you stretch, this is happening. You're dropping your pelvis and you're getting that opening. A lot of people feel like there's strain through their shoulders. So I have people go to a chair instead. And put the chair in front of the stairwell or whatever place you feel like you can hold. And then you can be sitting and you can still reach up and hold on and try, if you can, to have a slippery chair so that you can continue to push yourself a little further back. And again, my side view is I need to have my ear next to my arm, because if I don't and I'm dropping my head, that's basically like bending. I need to have my ears here. I can't be looking up or down. This portion can't be sticking up. It needs to be flat. So I always tell people, try and bring your chest forward, and then you'll end up with your lordosis. So the side view, you're reaching up for something. Hopefully you have something to grab to give you that traction or that opening. Because ideally, I'd like it to be that you're just hanging and gravity is pulling you down, but it does tend to be a lot on people's shoulder capsules, and it can be, it can produce some shoulder soreness for certain. So we're careful, always careful on this semi-hang, that you do it in a more of a modified manner so that you only give the pressure through your shoulders that you can tolerate. But again, that exercise, just like the one on your back, will really only help anything if you pay good attention to getting your alignment. I don't expect you to have a pole But some people, let me see if I can do it. Some people will actually put a pole like in their pants. And see if they can do the exercise and keep contact with just each spot. You know, not just my head or the hump of my back, that everything can keep contact and go through a bending. This is called hip hinging, and hip hinging is reproducing the same positioning we've been talking about all day. All our ears back, lumbar lordosis, because when we live our lives and we need to pick something up, we'll pick it up like this, but it would be always best if we could hinge at the hips, keeping that same alignment we want to keep when we're doing that hang or when we're correcting our spine. So a lot of people will take a pole or a mop or a broom, put it in their pants, have a sideways mirror if possible, and just practice this hip hinge. And it really does give the feedback if you can hold that straightening. That's just another little side investment to the knowledge of if you are holding yourself straight, because if you don't feel the contact on your head or your butt, you're in a C, the letter C. We always want to have it back and back. So that is my other exercise, and I think that kind of rounds out my ideas of offering, and hopefully if there's any questions, we can field any questions, and I have time to go through any answers for your particular ailments.
Okay, thank you so much. Thank you. I'm going to suggest that we go into gallery view, and that's a really nice way for us to see everybody. And hold on a second. So we have 31 screens. Gosh. Okay. So Kate Hay, I need your help. I'm going to look at everybody on the first screen. I want you to put your screen so you're seeing the back, the second screen. Okay. And we're going to look for hands up.
I have all 31.
You have all 31 on yours?
Yeah.
Good. That's great. Okay. So let's start. If you have a question, please just, raise your hand like this. You can just go like that. We're going to do it that way rather than using the hands up electronic method. First question is coming from Cecilia.
Okay, I've just had a Boston Scientific stimulator inserted in my back with 2 wires going up the spine. And it seems to be helping, except at night when my legs totally cramp up overnight. Are these exercises going to help me? I've had 2 back surgeries, biggest mistake in my life, but anyway.
You are feeling relief from the stimulator?
Somewhat, yes.
Is the cramping new, or is that something that's come only with a stimulator, the legs?
Well, I'm also taking quinine sulfate, lopinavir, and another muscle relaxant, but at nighttime, well, like last night, it was really, really bad. You wake up screaming in pain. But
Sorry to hear that. To answer your question though, these exercises are only returning your spine, your normal anatomy back to its best position, giving you the most space. So what I usually say to people who say, oh, I'm going to have an injection, should I do it around? All you're doing is opening the gates. You're giving full access to getting the best. So if the stimulator is working at one area really great, but the other area is not having that good access because there's some compression and there's not any of it exposure of those tissues, these exercises will be optimizing all of the exposure to whatever treatment anyone might be doing. The only thing would be the semi-hang gives a little bit more of a pull, And maybe you want to do that from sitting as a trial, sitting and then reaching up to establish that length before you totally hang just in, I mean, I'm sure the way they put the wire in is enabling you to have your full range of motion. They wouldn't compromise you. So you could probably do all of them. But if you decided to do the hanging one, do it from sitting and reach up first. But absolutely use all of the concepts I described with elongation and breathing. That will just help tremendously and hopefully just kind of complement what you've already had with the wires.
Yes, I also have to I tell you, I have a total rings all up and down my spine. They put those fusion rings in there.
Mhm.
I'm not quite sure that's doing anything but helping to compress the whole thing. But anyway, I'll give it a try.
Yeah, they're probably trying to decrease the ultimate compression by having the rings in. But you're offering a little bit of opening will just let some of the nutrients and oxygenated blood slip in there, and it might help some of your symptoms. We can only hope. Good luck,
Okay,
you know.
thank you.
Next question. Let's put your hand up. I don't see any questions. Kate, do you see any questions?
Mm-mm.
Wow, everyone's so healthy.
Oh, Louis, here
Louis.
comes Louis. Louis, you're still muted, even though your unmute is showing. You're. No, we can't hear you. I'm sorry. Louis, put your question or comment in the chat and Kate or I will read it to Sharon. Sorry about, we just cannot hear you. Anyone else? Put your hand up if you have a question. Well, I have a question. Okay, Janice, let me just say mine. Sharon, on your website, I did see a picture where you were working with a patient and the patient was leaning over and you were behind. And I was wondering, I'm just curious, you do some kind of exercise in that position? You have
I-
the patient do an exercise?
I wonder if it was the position where they were doing the hang and I was holding their pelvis and kind of pulling it down further. Let's see if I have that on here.
That's what it looked like. Yep, yep.
Yeah, maybe this one here.
Yes, maybe, yes, yes.
So that girl is doing the semi hang without bending her knees, the one I showed you.
I see.
She's super flexible, but anyone with tight hamstrings would have to bend their knees. But I'm helping to lower her pelvis because we want to give as much distraction to open as possible. So a lot of people really try to get long, bringing their bum down to have the help for that one.
Okay, thank you.
Sure.
Janice?
I'm wondering if this series of exercises will help with something like spinal stenosis and arthritis in the lower back. Will that be beneficial?
Absolutely. So stenosis is it's like arthritis in my elbow would take up space and maybe have some bone spurs and less of a ease of motion. Same thing happens with stenosis, but it's actually happening inside the canal. So it squeezes the spinal cord essentially. And so it makes for obviously a lot of neurologic symptoms and pain. What's difficult is when you don't have movement, if you have stasis of any joint, then you don't have any good circulation or any exchange. So the good thing with restoring your posture closest to its best alignment and then doing the breathing is you're actually pumping in the oxygenated blood into this little cavity, which is part of your spinal cord. That's all there to protect your spinal cord. But you're getting a lot of this, like a pump of all of the circulation, bringing the oxygenated blood in. So people do find, similar to if you have arthritis, you have soreness in the morning and then you wake up and, oh, things loosen up. I just got to walk around a little bit. It's just the classic arthritic complaint, lack of movement, lack of lubrication, stiffness. So by doing the breathing, by expanding, by opening, you're starting to get that pump into that region, which is otherwise really not gonna happen very readily. So yes, I would absolutely try to do the elongation, the opening and the breathing without gravity, especially with stenosis, because that's making it harder, and see if you can practice getting a little bit longer all the time. And you should be kind of superimposing that lubricant, that circulation into the regions that otherwise really are not accessible. So I hope you'll try it. Yes.
I certainly will. Thank you.
You're welcome.
Ginny? Yeah.
I wondered if those breathing things would help with strengthening the pelvic floor, because the hypopressive breathing techniques have similar expanding your rib cage and breathing out, and going to apnea where you don't breathe.
You know, it is different because we are more reliant on the rib cage and the lobes of the lungs, whereas the pelvic floor work is done obviously lower and around some of the musculature down lower. So I don't know. I'm not familiar that it would have any correlation or any help there.
Now, how hypopressive breathing is more practiced more in England and Canada and Europe than it is here. So it supposedly does bring the diaphragm and things up higher, try to, and some of the breathing is similar to what you have.
That sounds super. And do you do it for the pelvic floor work?
Yes.
And is it working?
Well, it's supposed to take 3 to 6 months. I think it's hard to tell. It's only done it for about a month. So we're still experimenting.
Good. I've heard a few therapists, gosh, I think there's one in Guilford or somewhere along the shoreline that is supposed to be phenomenal and really changing things, which is so good. It's similar a little bit with the Schroth physical therapy for scoliosis, where it's kind of new and not a lot of therapists do it. You have to have a specialty, but if you can find one and it's and they're a good one, hopefully it will help reduce some of those issues.
I'm gonna read Louis' question comment, and then Gary Rudnick has a question. Louis says, good talk. I've been dismissed by my surgeon after the conclusion that hardware and arthritis are now so extreme there's nothing left to do. X-rays seem to me to show the wedge-like invertebrate shape you describe is now permanent at the LS locus. But your exercises sound very sensible, and I'd like to get them into my routine.
Yeah, a lot of times, did you say, yes, you had a fusion or no? Yeah, and was it L5S1 or upper L? 5, 4, 3, 2 to 1, 2. So, is your sacrum fused to your L5? Okay, so yeah, you will have, even when you have a fusion, you can still collapse. We still have options for you to go further and further and further. Alternatively, you still have room to come out of that within your fusion. So you still can, in your case, when you're sitting or when you're standing, you're going to be compressed. So you need to get off your feet and be supine or side lying or some way. But when you, like I was lying down, if you can really get your feet pushed away, some people will lie down on the edge of the bed get their feet so that their heel is off the bed, and then try and move away so that you get a little bit of a distraction of your legs a little bit pulling out. And then bring your arms up, see if you can get as long as you can, and then hopefully you could attain a little bit of opening and length in that scenario. We do a thing kind of like, did you ever have the traction at PT when they did the pulling of your pelvis? No, usually they do that first before fusion, but we put a belt around someone's waist and then put another belt through the waist belt and attach it to like the bottom of the leg of the bed or the dining room floor. And as you lie on your back and you move away from that leg, it pulls the belt around your waist to give you that little bit of an opening. But by trying to open that space a little bit, again, you're kind of offering that improved circulation, and that should help. But that's a stinky scenario, not only to have that, all that hardware and that bad report, but to be told there's nothing you can do. So hopefully you can try a little these things. And if you need any more ideas for how to do the belt, I can send you an email about that, how to hook that up so that you can maybe trial that. It gives you a little bit of distraction, not a lot, but enough to take a load off. I mean, you're standing on your pelvis all day, we're sitting on our pelvis. The opposite is opening it a teeny bit, and that should help. You're welcome.
Gary, you still have a
We'll make
question?
sure that we've got your email, okay, Sharon, at the end?
Yes.
Good, thank you.
Hi, so I had a back problem. I didn't have pain, but I had some pain in I didn't have pain in my back, but I had pain in my leg, in one leg, and I had foot drop on that side too. And apparently it was caused by one of my lumbar vertebrae being sort of shifted forwards and causing stenosis. And I went and got some PT help, which was very helpful. But it involved me trying to to decrease the curve, the lumbar curve, so there would be less pressure squeezing that vertebra forward. And it seems, so I don't know, it sounded a little bit contradicting to what you were saying about, maintaining that curve. I mean, the advice that I got seemed to be all in the direction of trying to decrease it so that there wouldn't be that pressure squeezing that vertebra forward.
Absolutely. So in that case, you're absolutely right. If you're having like a slippage or anterior slippage and you do a back bend, for example, like a gymnast, that would not be good. And that's what a lordosis is. It's increasing that hole or that hollow. Again, the right direction to go in is to lie you down and have someone pull your legs this way and pull your arms that way. We need to reduce it backwards, but not by doing a pivot, not by pivoting forward or pivoting backwards. That's not doing anything. You need to get space first. And then that space comes from elongating and then maybe recruiting some of your abs. Did the PT that you did that help?
It helped a lot. Yeah. I mean, it was to the point where every time we would go out for a walk, I would have to stop once in a while. And the way I solved it myself before this was just to squat down into a deep squat so that my back was sort of curved more the other way. And I could feel it getting better as I was in that position, and then I would walk around. But after I started doing the exercises, basically to try to teach me to walk with my pelvis tilted a little sort of backwards from the top, that it seems to be good. I mean, I've been going for a few years, and the pain is much reduced. Once in a while I feel it, but not very often.
Good. Yeah, that's really smart. If it starts coming back again, you should trial the supine elongation, because as you can imagine, like this is your vertebra. If you're lying on your back, maybe your sacrum's here, and then you're coming up with this one that flipped forward, and then coming back to all the rest. But if you pull yourself away, the structures that have gotten shortened because they're coming forward, they get a little stretch. And that's the hard part to do sitting or standing, because you're already kind of forward and falling off. So you're not going to get the space until you open some space to reduce back. But it sounds like you're doing the right thing, and keep it up.
Thanks. That makes sense what you just said.
Great.
Let's take a couple of more questions if you have. Anybody? Okay, we don't see any more. Let's see. Sharon, would you like to tell us how people can get in touch with you? Maybe you could give us a phone number and an email, and we will also have those in the office if anybody cannot, write them down at this moment.
Sure. So, I wish I had a way to write it on my screen, but I'll give you my phone number first, because that's easiest. And if anyone wants to call or text, that phone number is 860-501-2272. And
Okay.
the name of the business that I have here is called Inline Physical Therapy, because the expectation is that you will get in line and stay in line. But I say that because if you feel like it, you could go, if you can remember that Inline PT, you can Google that Inline PT, and my website has a lot of the same information and some videos of me doing silly things like I was just doing. So it's a little bit more involved, and it's just in Google under Inline PT. And then my information is there on my phone number and stuff, but my email is sharon@inlinept.com.
That's great. And I think I understand your office is in Old Lyme.
That's correct, yes.
Any chance you'll ever work this down near New Haven?
I don't
I don't
think
mean to put you on the
so.
spot, but
No, I'm actually presently in a specialty of mainly spinal malalignments, kyphosis, scoliosis, a few different other flat back syndromes, a few other things that I do that are more pinpoint. And I usually tell people, if you have something that is more common, like sciatica or like a stenosis that's really bothering, get to a clinic that is easily accessible and that you can go to and that you can get some information. I'm a believer in giving the information so you can take it home and keep doing it for a long period of time. So I don't see people a lot, but and I also don't do any modalities like heat, and so I'm not like classic in the regular traditional physical therapy mode.
okay. Judith, would you unmute yourself if you would like to make some closing comment?
Oh, I thought I was unmuted. I had unmuted. But then it muted itself.
No, I muted you.
Oh, you muted me.
I did. Yes, I did.
Because I'm coughing.
That's
I
fine.
just wanted first to say that I think you do some PT on Zoom, don't you, or online?
Yes, I do. You're right.
It's probably not quite as effective as being pulled down in that hang, which I have experienced, and which makes you feel really great, as weird as it sounds.
Oh,
And
I
such
love that
things.
pitch. Oh.
Yeah, it's quite a great experience actually doing it. And I hope the results will show someday, but so far they're good. And I think you've shared a great deal of what I've learned. You haven't talked as much about the equipment because that comes with the shrine, with the actual PT. So for those of you who would like to try it, it's an extraordinary experience. Very sadly, because this comes from Europe, like so many good things, it's not yet covered by Medicare. which is a real bummer. And as Sharon says, it will be when they get the point. But it is worth the investment if it's possible, because I mean, as I started by saying, I really feel I'm in a completely different mindset, let's put it that way, about my body and the possibility of improving, rather than be really down in the dumps when it comes to seeing the future and the future future losses that were inevitable, certainly in my case, and probably that of some of the people around here in our group. And it's changed things, and I think Sharon has given us a good idea of how it works, and I'm very grateful to her for coming and doing this. And I get to see her in an hour and a half, so I better go and get lunch and drive the 52 minutes to get there. But there are great stops on the way back. Definitely good things to do on the way back as well.
All right.
A terrific session there. So thank you, Sharon, and thank you, everybody, for coming.
Thank
Yeah,
you.
thank
Thank
you,
you, Sharon.
everybody, for listening and for your interest. And I hope you take a little bit home, because all of us can be taller.
All right.
All right. Take good care. Thank you.
Great. Thanks,
Thank you
Thank you
Megan.
so
so
much.
much for your time and expertise. Thank you.
Bye-bye.
Bye, everybody. Thank you.